So today we're going to talk about squats and some different hints and common errors that are associated with squats and some common errors associated with spotting of the squats. And to do this, we'll be using some scientific terminology about the joints and the movements. Some helpful tips on squatting is before you even get started squatting, make sure that you have a spotter that you trust who will give positive and efficient feedback. Make sure that when you do squat, to have the bar set at a comfortable position on your back. You can do it by like rolling it up or down until you find whatever feels best for you. Also, when you do begin to squat, make sure that you're wearing proper footwear, that you're not going to trip and fall over, and keep your feet flat when you do this, and make sure that you keep your back straight at all times so you're not going to curve over, injure your back, or lose balance. You need to get the straight back.
Wait. You can't even beat these. You got it? Hello? Bears in the night? I'm down, bro. I'm down.
Help. Alright, so the joints that are being worked during this exercise are the acetabulo-femoral, more commonly known as the hip, the tibiofemoral, more commonly known as the knee, and the talocrural joint, more commonly known as the ankle. So during the eccentric phase, you are flexing at the acetabulo-femoral joint, flexing at the tibiofemoral joint, and dorsiflexing at the talocrural joint. During the concentric phase of the exercise, you're extending at the acetabulo-femoral joint, extending at the tibiofemoral joint, and plantar flexing.
The palm movers at the acetabulo-femoral joint during hip flexion, also known as the eccentric phase, are known as psoas major, origin as T12 through L5, insertion is lesser trochanter of the femur, the iliacus, origin iliac fossa, insertion lesser trochanter of femur, the sartorius, origin anterior superior iliac spine, insertion upper shaft of tibia, the rectus femoris, origin anterior inferior iliac spine, insertion tibial tuberosity via patellar tendon. And the last one, pectineus, origin superior ramus of pubis, insertion lesser trochanter and linea aspera of femur. The assisters for hip flexion would be the gluteus minimus, origin outer surface of ilium, insertion greater trochanter of femur. The gracilis, origin body and inferior ramus of pubis, insertion upper shaft of tibia. Adductor longus, origin body of pubis, insertion linea aspera of femur. Adductor brevis, inferior ramus of pubis, is the origin, insertion linea aspera of femur. Adductor magnus, origin inferior ramus of pubis and ischial tuberosity, insertion linea aspera and adductor tubercle of femur. The primary movers at the tibiofemoral joint during the knee flexion also known as the eccentric phase, are bicep femoris, origin, ischial tuberosity, and linea aspera of femur. Insertion, head of fibula and lateral condyle of tibia. The semitendinosus, origin, ischial tuberosity, insertion, medial surface of tibia. Semimembranosus, origin, ischial tuberosity, insertion, medial condyle of tibia. The assisters are sartorius, origin, anterior superior iliac spine, insertion, upper shaft of tibia. Gracilis, body and inferior ramus of pubis, is the origin, insertion, upper shaft of tibia. Popliteus, lateral condyle of femur, is the origin, insertion, upper posterior surface of tibia. Gastrocnemius, origin, lateral condyle of femur and medial condyle of femur. Insertion, calcaneus via tendocalcaneus. Plantaris, origin, lateral supracondylar ridge of femur. Insertion, calcaneus via tendocalcaneus. The primary movers at the talocrural joint during dorsiflexion, also known as the eccentric phase, are extensor digitorum longus, origin, upper 2/3 of fibula and lateral condyle of tibia. Insertion, middle and distal phalanges of digits 2 through 5. Extensor hallucis longus, origin, middle half of fibula, insertion, distal phalanx of hallux. Tibialis anterior, origin, upper half and lateral condyle of tibia, insertion, medial cuneiform and first metatarsal. And there are no assisters for the eccentric phase of dorsiflexion. The prime movers at the acetabulofemoral joint during hip extension, also known as the concentric phase, are bicep femoris, origin, ischial tuberosity, and linea aspera of femur. Insertion, head of fibula and lateral condyle of tibia. Semitendinosus, origin, ischial tuberosity, insertion, medial surface of tibia. Semimembranosus, origin, ischial tuberosity, insertion, medial condyle of tibia. Some of the assisters are gluteus maximus, origin, iliac crest, sacrum and coccyx, insertion, gluteal tuberosity of femur. Assisters are gluteus medius, origin, outer surface of ilium, insertion, greater trochanter of femur. Gluteus minimus, origin, outer surface of ilium, insertion, greater trochanter of femur. And adductor magnus, origin, inferior ramus of pubis, ischial tuberosity, insertion, linea aspera, and adductor tubercle of femur. The primary movers at the tibial-femoral joint during the knee extension, also known as the concentric phase, are rectus femoris, origin, anterior inferior iliac spine, insertion, tibial tuberosity via patellar tendon. Vastus lateralis, origin, lateral surface of femur, insertion, tibial tuberosity via patellar tendon. Vastus intermedius, upper 2/3 of femur is the origin, insertion, tibial tuberosity via patellar tendon. Vastus medialis, origin, medial surface of femur, insertion, tibial tuberosity via patellar tendon. And there is no assisting muscles for this one, for the concentric phase. The primary movers at the talocrural joint during plantar flexion, also known as the concentric phase, are gastrocnemius, origin, lateral condyle of femur, medial condyle of femur, insertion, posterior calcaneus via tendocalcaneus. Soleus, origin, soleal line and posterior fibula. Insertion, posterior calcaneus via tendocalcaneus. The assisters for the plantar flexion and concentric phase are plantaris, Origin, lateral supracondylar ridge of femur. Insertion, posterior calcaneus via tendocalcaneus. Fibularis longus, origin, upper 2/3 of fibula. Insertion, medial cuneiform, first metatarsal. Fibularis brevis, origin, lower 2/3 of fibula. Insertion, base of fifth metatarsal. Tibialis posterior, origin, posterior surface of tibia and fibula. Insertion, navicular, cuboid, cuneiforms, and second through fourth metatarsals.